Hey Josh, today we're going to work on our hip mobility, hopefully building up the muscular endurance of your lower back and starting to create a fundamental pattern which will help you in your day-to-day life. To do this, we're going to introduce 3 exercises and hopefully progress from the first one depending on your pain. The first exercise we're going to do is the quadruped rock back. Basically, we're going to start with our knees shoulder width apart, coming down onto the floor. I'm going to have my hands flat on the ground with our back straight, like so. We don't want this, and we don't want to start like this. Once we're in this nice position, we're going to look over our fingernails and we're coming back and up. From this position, we want to poke our bum up to the sky, but we don't want to come down so low that we develop a bum tuck. So like this. Be proud of yourself, chest up, coming back and forward. I want you to start slow and you can build up at the end of the reps. We're going to do 8. I'm going to use this ruler as a cue, and this is where I want you to touch. 1. Slow it down a little bit, make sure you touch my ruler. Come back, make sure you touch. Yep. Okay, do another 5. You can look down here because we want to make sure the spine is in its natural position. Okay, 1 more. Okay, that's good. How did that feel?
Yeah, fine, very fluid movement.
How did you feel in your hips? Based on your flexibility, did you feel it starting to unlock?
I did.
Because that's what we're going to focus on. Can I get your pain scale of 1 to 10 of your lower back?
2.
2. Okay, so that's great. What we can do with that is progress this exercise to actually using a hip hinge, which will activate the muscles a little bit more, making you work harder. What we're going to do for this exercise is we have this, and we're going to face, this can come up, we're going to grab it around our back, like this, and this is going to go just above our hips, like this. This is going to make sure we want all of this fat on our back, so if I bend the back, that's going to happen, and I don't want that. So this is going to be a cue to remain flat on your back. This is going to judge your depth. What I'm going to do is start here. We're going to have a slight bend of our knees, and we're coming back until this is touching that, and that's when you're going to come back up. So this is managing your depth. Coming up. Once we're hit in this position, we're coming back up. So I'll get you to stand about there. Hold this. Yep. Slight bend in the knees, and we're bending until we hit this. And we're coming up. That's great. We'll do 4 more. Make sure this is flat on your back. 3 more. 1, 2, 3. Okay, that's great. How was that on the pain scale of 1 to 10 for your lower back?
Yeah, the same as before.
Okay. So what we're going to do is we're going to move on to the next exercise. What I'll just say for that, I'll give you some feedback. That was really good. Next time, what we can do is just have a little bit more slight bend in the knees, and we can stand out a little bit further so you can get a little bit deeper. The next exercise is called the Earphones, one-legged deadlift. What we're going to do for this is we can use this for support, because we're really going to challenge the stability of this hip. What we're going to do is basically the same exercise as we've done, but we're going to do it on one leg. What we're going to do is choose whichever leg you want. Start with a bend in the knees. This can be sitting here, and we're going to run our hand down and push our leg up. So standing here, bend at the knees, have this hand here, coming up and up. Okay? So we're going to slide this down, have our knee up. We want our torso square, so we don't want We don't want to be like this, and we don't want it to be like that. We're going to have it nice and square, like this. Okay? Whenever you're ready to start. So what I'll get you to do is just try to tap your back of your foot with this, touching the ruler. Try to touch it. That's good. Try to touch it. Keep that going. I'll just get you to bend at your knees a little bit. Yep. Square your shoulders a little bit. So when you come down, what we can do, take this out. Now I'm going to help you. See if you can do it by yourself. If not, I'll be here for support. Make sure we're getting this leg up. Yep. Bend at the knees a little bit more. Okay, go. That's good. How did that feel?
Yeah, fine.
So you're starting, did you feel that your balance was challenged a little bit more than all the other
Yes,
exercises?
Definitely.
Did you, what was the pain scale on your back?
Probably 3 this time.
Okay, so that's good. You didn't feel any pain in your left leg at all?
Yes, I did.
Just a little bit?
Just a little bit.
Okay, well what we can do next time is we'll keep this balance for your left leg, and on your right leg you can remain unbalanced. We'll take the chair away. Okay, now I'll justify why I chose the exercises that I did. First of all, I had to find out what I knew about her. I knew that she had spondylosis and that there was spinal degeneration and pain. This means there's going to be instability, morphological changes, and functional deficits. Also, she's using Lyrica for the treatment of that nerve pain. Now, because she has spinal degeneration, this is going to cause structural disruption. And this could have been caused by poor mechanical loading. Now, we don't know the source of the lower back pain, but it could be from fibrosis, osteoarthritis, sclerosis, or stenosis, but we're unsure of this. And we know that her lower back pain can radiate to her left leg. Now, I know that exercise of the lower back pain can decrease the pain experienced and decrease her disability and the time off work. Knowing this, it provides few evidence to suggest proper exercises that worked on the functional movement patterns of the hip, which is where all these muscles connect. So first, the quad root back starts with quasi-isometric contraction of the erector spinae, has extension of the glute max, and extension of the biceps femoris long head, semitendinosus, and semimembranosus. Now I started with this because this is where her base of support is going to be high, and from this I wanted to rate the pain, and then we can decrease the base of support, and which will cause more activation from these muscles. But really I was focusing on introducing the hip hinge pattern and muscular endurance. Now the next movement was the hip hinge. Now the hip hinge is we're decreasing the base of support, so we need increased stability, and I'm still working on muscular endurance. But what we have here is extension of the gluteus maximus again, extension of the biceps femoris long head, semitendinosus, semimembranosus, and we have a quasi-isometric activation of the erector spinae. Now, what is different from this movement from the last is what we're increasing the torque on the trunk. The upper trunk torque increases as we're moving out of the base of support, which means the torque experienced at the lumbosacral joints is going to increase, which means it's going to have to be met by increased activation of the hip muscles. The next one is basically the same fundamentals, is the arabesque deadlift. What we do is this is going to need the most stability as we're taking away everything from the base of support. Of course, we have extension of the glute max, we have quasi-isometric contraction of the erector spinae, and we have the biceps femoris long head, semitendinosus, semimembranosus, all active. Now, again, same fundamental principles. We're going to be increasing the upper trunk torque. This is going to increase the torque experienced at the lumbosacral joints. which means it's going to have a greater activation of all three. That's my justification.